My name is Phil Knutson. I'm president of Forefront Telecare. I'd like to take a few moments to introduce you to our services. We offer a CMS and HIPAA-compliant telehealth program to bring medical professionals to rural and shortage areas around the country. We are currently operating in 16 states, from New York to California and from Minnesota to Texas, delivering behavioral services via our telehealth network to skilled nursing facilities and clinics. If your health facility needs psychiatrists or clinical psychologists, we provide a cost-neutral solution for skilled nursing facilities and staffing options for hospitals and clinics. Forefront provides all hardware and software to link providers to your residents. Forefront also provides easy online scheduling to book appointments, and we monitor and support both you and the doctors to make sure your connection for every session is good and there are no problems. Our providers don't work for us. We recruit them onto our network and introduce them to you for your direct credentialing. Our agreement with your facility is month to month, so there's no long-term commitment. We believe in our service and our providers. We invite you to try our service for a few months. We are confident that we can make a big difference for your residents and staff. We've been offering services since January of 2011 and have arrived at a methodology and recommended plan of care that has effectively eliminated hospitalizations for behavioral reasons. Our care plan involves having all of your residents who are on any kind of psychotropic medication be screened by the psychiatrist during the first 8 weeks after installation of the system. Each week we will see residents as you triage them to be seen, from those on antipsychotics all the way to antidepressants and everything in between. Everyone on one of these medications gets seen, including dementia residents. Coming out of this screening process, the doctor will provide consultation to the attending physicians and the director of nursing about ongoing care plans, confirm current plans, recommend changes, or identify some for gradual dose reduction. We will also have a profile for how much time will be needed each week after the screening process is completed. Some residents will be recommended for quarterly reviews in concert with your PHQ-9 surveys. Most will be recommended for monthly medication management, and for those that are going through GDRs, the doctors will most likely want to see them weekly to support the staff. By coming weekly for a few hours virtually, instead of monthly for a day or so, our doctors are able to provide clinically optimal care, be available for new move-in residents who need an assessment done, and be available for emergencies. The weekly routine also spreads out the staff time into manageable, smaller time blocks to minimize the impact on your daily operations. Our model is geared to becoming an integral part of the care team in your building instead of a drop-in provider who helps out with just difficult behavioral cases. Our doctors bill Medicare for their services directly. Forefront bills your facility a fee that is set by CMS each year for each patient session as you use the service. This year the fee is $24.43. This fee is called an originating site facility fee and is outside of your other bundled pricing. We provide your billing folks with an instruction sheet on how to apply for this reimbursement. In most states, Medicaid also pays for the same fee for those residents who are not Medicare eligible, as do most commercial insurers as well. Medicare pays 80% of the fee, of course, and the balance is paid by supplemental coverage or families. If there's no one to cover the 20%, then we waive the balance. Forefront also covers the cost of a dedicated internet connection that we suggest you get so we don't interfere with other applications on your current networks. So at the end of the month, this service will not cost you anything. We have providers in most states in the country available to meet your needs that are part of our Telecare network. To find out about your facility's eligibility, you can go to our website at www.forefronttelecare.com and go to the facility section and click on your state on the map. The blue counties are eligible for this reimbursement program. The hatched out counties are not. We welcome you to contact us today to discuss next steps. Thank you.